The Moyamoya disease is a disease of the brain vessels, which was first described in 1957 in Japan. First of all, the blood supply to the brain may need to be explained in a very simplified way. In principle, we have two carotid arteries and two arteries at the back of the neck, the so-called vertebral arteries. These four vessels supply the brain. The brain has a total of 6 vascular territories. There are 2 at the front, 2 in the middle, and 2 at the back. In Moyamoya disease, it is mainly the proximal parts of the vessels that occlude. These are the vessels very basal at the beginning of the brain, very close to the skull base. When these vessels occlude, fine collaterals develop, which look like a puff of smoke in angiography, giving the disease its name. In patients, the stenosis or occlusion of the vessels leads to a reduced blood supply to the brain, which can cause symptoms. On the one hand, so-called TIAs can occur, which are transient ischemic attacks. These are basically stroke symptoms, which are not triggered by a manifest stroke and are completely reversible. There are also patients who experience manifest strokes with neurological deficits that occur and might not be reversible. In addition to these manifest symptoms, patients often also report more general symptoms, such as fatigue, headaches, and, in rare cases, epileptic seizures. In European patients, TIAs or strokes are the most common first manifestation of Moyamoya disease. The disease is extremely rare. In Germany, we expect around 30 new cases per year, based on the numbers available. However, from our experience, we assume that these numbers are significantly too low. We estimate that around 2 to 3 times as many patients in Germany are affected newly by the disease each year. There is a so-called juvenile form of the disease, which mainly affects patients under the age of 10, and an adult form, which affects patients aged around 35 to 40. But the disease can ultimately occur at any age. However, these are the age groups in which the disease most often becomes symptomatic for the first time. Women are generally affected twice as often as men. The disease can be so-called familial, that is, there are several patients in a family tree who have Moyamoya disease. However, this is very rare. This is to be expected in less than 10% of cases in Europe. In most cases, Moyamoya disease occurs sporadically. That is, the disease occurs purely by chance. If other genetic diseases are present along with the disease, such as trisomy 21 or neurofibromatosis, it is not referred to as Moyamoya disease, but as Moyamoya syndrome. The cause of Moyamoya disease is still unknown. It is assumed that a combination of several factors ultimately promotes the development of the disease. We do not know exactly what these factors are. It is assumed that a mixture of genetic factors, but also environmental influences or infections, for example, work together to ultimately trigger the development of the disease. There is a chronic form of Moyamoya disease and an acute progressive form that develops acutely and progresses. In patients with a chronic form, the disease exists for many years, and the body has managed to get enough blood into the system via collaterals. Therefore, patients may not have had any symptoms for a long time. In patients with acute disease progression, which means an acute development of the disease in which the narrowing of the vessels progresses, symptoms can occur early on, because the body has not yet had enough time to create collaterals to get enough blood into the system.
ausreichend Blut in das System zu bekommen.